Monkeypox cases surging in San Francisco. Health officials say they don't have the resources needed to support the community. The Department of Public Health in the city says it's been begging for more monkeypox vaccines, but without response from the CDC. Good evening, everybody. I'm Vicki Liviakis.
And I'm Catherine Heenan in for Grant Lotus. Today on the steps of City Hall, the city's health director, along with a San Francisco supervisor, blasted what they say is a weak federal response. KRON 4's Rob Nesbitt talked to someone who spent the last 2 days waiting in lines trying to get a vaccine. He joins us live with more. Rob, that's got to be frustrating.
It is, Catherine. I started to see the posts online of long lines at monkeypox vaccination sites in San Francisco starting Friday. Those waiting for their first 2 doses hope that the city's request for more will be approved. Eager to get a monkeypox vaccine, Jake Lahr waited in this long line at San Francisco General Hospital Monday afternoon. He was eventually told that all shots were spoken for before making it inside.
They cut the line in front of us and said, "You guys have to go home." The folks who I know who were just in front of us who did get to stay in the line, I think waited almost 2.5 hours.
He returned Tuesday to this, waiting 2 hours just to schedule an appointment for later in the afternoon.
They are trying to do the right thing, get vaccinated, protect themselves, protect others in the community. I think it's just been a really frustrating response.
Director of the San Francisco Department of Public Health, Dr. Grant Colfax, says his requests to the federal government for more shots have gone unanswered.
We are literally begging our federal partners to provide more vaccine so we can get it into the arms of people who need it most.
Dr. Colfax has requested enough supply to vaccinate at least 35,000 people who are most at risk. Supervisor Raphael Mandelman introduced a resolution Tuesday calling on the CDC and Department of Health and Human Services to purchase and distribute more shots.
This should be a preventable public health crisis.
Criticizing the federal health plan to distribute 800,000 vaccines by the end of summer and 2 million by the end of next year. Numbers that don't fly for those waiting to do their part in stopping the spread.
If it's impossible to get a vaccine here, what's it like in Arkansas? What's it like in Mississippi? Like it just, baffles me.
Since June, the San Francisco Department of Public Health says it's received around 2,800 monkeypox vaccines and has distributed more than 95% of those to community clinics and sites in the city. Reporting live in the newsroom, I'm Rob Nesbitt, KRON 4 News.